Hello, Dr. Dan Yachter of Elevation Health, and this is the Wednesday segment of news, views, and weekly updates. And very happy, as always, that you join us. And many of you guys are going to be watching the live stream later on, but we've got very important information to share with you. I'm going to go ahead and dive into and kind of circle back to the content that we covered at the Heart Smart Masterclass. And I know it's going to be valuable to you, and I know you'll get a lot out of it. Before I get into that, I just wanted to make a couple of announcements in regards to some upcoming special events. We have the Patient Appreciation Day, the semi-annual Patient Appreciation Day. That's going to be coming up next Thursday, October 9th. If you are an active patient, please stop by. We have fun food, just a whole bunch of really cool stuff, free adjustments. We do this day to honor you as an active existing patient, to honor your commitment to the chiropractic lifestyle. And then, of course, on the 14th, the following Tuesday, the 14th, we have, and by the way, that party day on the 9th is from 11 to 6, but on the 14th from 11 to 1, we also continue to honor you with allowing you to refer in friends, family members, and loved ones on that day from 11 to 1, no charge, all free services for consult, exam, a workup, and an opportunity to see if chiropractic can help you achieve your best possible level of health. We're here to help, and we are here. The whole reason that this office exists is to make a positive, life-changing, health-transforming impact on this community. And that's why we do this twice per year. We remove all the barriers to entry so you can come in. You can send in those people that you really care about, want to see you live a healthier life. And then also, if you've been away from the office, been away from the clinic for a while, we will allow you to come back, restart care at no cost. You get to save a ton of money by doing that. So keep that on your radar. And then, of course, on October 21st, we have our hormone, thyroid, and stress management masterclass. It's a phenomenal masterclass. In fact, it is the most popular masterclass. I'm not quite sure if you can call it the most important one, but it is the most popular one that we have throughout the year. Hormone, thyroid, and stress coming up right around the corner. So what I wanted to do, as I mentioned, is circle back around to the Heart Masterclass content. And I wanted to touch upon two things. One, the spine's involvement with heart health, in particular the atlas and the vagus nerve. Vagus nerve, many of you guys have heard of. It's in the news quite a bit. And I'm going to drill down a little bit on that topic. And then the other one I wanted to talk about is the panel that we run in our office, the Heart Smart blood marker panel, and what the markers mean, why they're important. I'm going to break it down. For those of you guys who are getting annual blood work, you're going to want to listen to this segment. You're going to want to hear about these markers because many of the markers are being left off of your panel when you go to get your blood work done. And these are critical markers that you want to know about. So let's go ahead and dive in and put your seatbelts on. And we're going to go ahead and start off with the spinal component of heart health. Most people don't know, they've never seen this before in certainly an anatomical picture, how there are 12 cranial nerves in the brain. And there's really only one that exits, it loops over the first bone in the neck called the atlas vertebrae, and it dives down deep into the core, into the internal core of the body. And it's innervating every organ, gland, and blood vessel in the human body called the vagus nerve. It's a Latin word, vagus, translated in English really means wanderer, like a vagabond, right? Vagabonds wandering all over the place. So vagus is the wandering nerve. There's a lot in the medical literature. There's a lot of medical science focused, research focused in on how to really artificially stimulate, manipulate the vagus nerve with shock therapy, electrical stimulators that are actually embedded in the skin that shock the vagus. There's an easier way to stimulate the vagus, vagal tone, to improve vagal tone, and thereby improving organ function, gland function, and blood vessel health. And so if there was a picture I could post right now, in fact, I'm going to put this in our private group. Again, if you're not part of the private group, join my private group, My Family, My Mission, where you can see all this content that's posted there regularly. But if you had the picture in front of you, what you'd be looking at is this draping of the nerve that comes out and wrapping around the heart. And that vagus nerve literally goes into something called, well, the pacemaker or the SA node of the heart. And so a lot of people have to go get pacemakers later on in life to regulate the flow of electrical current through their heart. But the SA node, which we're all born with, it controls and it really dictates, orchestrates the rhythmic flow of electrical current through all four chambers of the heart. And the vagus nerve goes right into that SA node and literally controls the SA node, which controls the electrical current of the heart. So it's really important to make sure that chiropractically that vertebrae is aligned, and so as to make sure that it's not torqued, twisted, rotated, wedged. It's not interfering structurally, creating a biomechanical irritation or impediment to that nerve, because if it is out of alignment, it can disrupt the normal communication, the normal regulation. As that vagus nerve is connecting into the body, the regulation of a lot of things, especially the heart. So it's very important, whether my office or another office, maybe you don't live near my office, that you find a chiropractor, not because you have a heart problem, but you just want your heart and your whole body regulating well. And again, the first bone in the neck, the atlas vertebrae, has everything to do with the normal function of your vagus nerve, which controls every major organ gland in the body, especially the heart. If you want normal regulation of heart function, you want to make sure that that atlas vertebrae is aligned properly. And I always remind patients, if you have a heart problem, you come in, if I adjust your atlas vertebrae, does it mean your heart problem is going to go away? Not necessarily. What it does mean is if that vertebrae is aligned, it means that the communication going to your heart, it's going to work a whole lot better. Your heart's going to work better. And who knows, maybe your heart problem will resolve. But everybody needs to have open, clear channels and a well-performing heart. That's the point. So you have the vagus nerve, C1, 2, and 3, the nerves coming out in that area of the atlas, this first two bones in the neck, have a huge amount to do with the valves, mitral, the tricuspid, the bicuspid, have a huge amount to do with the atria, the atrium pumping properly, the top chambers of the heart, the C7, C8, T1, T2, T3, and T4 nerves, top part of the back, lower part of the neck, control ventricular function. The muscles of the ventricles, left and right ventricles, literally determine the power and strength of the pumping power and strength of the ventricles, all controlled by the upper part of your back and the vertebrae of your neck, all the way up into the atlas vertebrae. So again, the purpose of chiropractic care of your spine in its relationship to the heart is not to get chiropractic care to cure heart problems, but to keep the nerve channels open, the very nerve channels open that are allowing your heart to work normally. Everybody should have and deserves to have wide open nerve channels. Very important consideration, right? So one last consideration, something that we do at our office, is heart rate variability. And again, these pictures will be posted, so you'll have a reference point is in terms of what I'm actually talking about. But heart rate variability may, in fact, be one of the most important biomarkers of heart health. This is different than a blood pressure cuff around your arm, looking at the plumbing. This is looking at the balance, the electrical function. It's looking at the intervals between heartbeats. You want a lot of variability, and the more variability you have, that translates into higher adaptive capacity of your body, of your nervous system, higher resiliency, the ability to take on more physical, emotional, and chemical stress and live successfully through it. In order for you to have a heart attack, you must experience both a drastic decrease in parasympathetic activity in the nervous system, which is the relaxatory side of the nervous system, and an increase in sympathetic or fight, flight, freeze, adrenaline side or adrenaline activity of the nervous system. 75% of heart attacks are triggered by the autonomic nervous system, primarily emotional stress, not by a blockage. A lot of cardiologists and cardiac nurses will tell you, well, the biggest issue with heart problems or heart issues are blockages, blockage of the heart. Not necessarily, even though we know that's a serious issue. It's actually emotional stress that sends the heart into electrical chaos that could result in arrhythmia, AFib. It's an electrical chaotic event that's brought on by stressful thoughts, as we always say, stinking thinking. So you got to be careful with that, with the impact of stress on your heart. Heart rate variability study, something we do at our office. We do it either with an ear clip, a finger sleeve, or a 3-finger placement into a device. And it's actually looking at the balance between sympathetic fight or flight and parasympathetic relaxatory balance. And we look for the white circle, which is you, to fall into a balanced range into the zone 5, the green zone. And that can show us if you are living in a balanced state autonomically. If you're all the way over onto the sympathetic dominant side, that can be a serious problem. You're more prone to have a cardiac event. Again, the chiropractic adjustments have a significant impact and influence over heart rate variability, vagal tone, and the overall function of heart health, heart function, heart health, heart balance, and heart longevity. So with that being said, I wanted to bring that into the conversation first. The importance of a healthy spine, healthy neurology, healthy heart function, importance of regular chiropractic care. It all goes back to having a healthy heart long term. Now we're going to go ahead and jump into the biomarkers. When you go to get blood work, you want to make sure, if not annually, at least at some point on a regular basis, you want to have these looked at. These are very critical markers when it comes to your long-term health. The blood cholesterol markers, in fact, are not the most important numbers. The most important numbers are the metabolic numbers like insulin, blood glucose, and hemoglobin A1C. If your blood glucose is off, you're going to have inflamed physiology. Your metabolic state is going to be in imbalance. And that's what's got to be rectified, not necessarily the blood lipids. But with that being said, I'm going to run down the blood markers. These markers you want to make sure you have in good ranges or below certain numbers. And the first one I'm going to start with is total cholesterol over HDL. If your doctor puts you on a cholesterol medication based off just total cholesterol, they're missing the big picture. The first ratio that you want to look at is total cholesterol divided by HDL. You certainly want that number under 5. Then you have the next marker, small dense LDL, hardly ever looked at, almost always left off the panel that your doctor's calling in to LabCorp or Quest, is small dense LDL under 20. The small dense LDL, when they get inflamed or oxidized, they are most prone to hardening and clogging your arteries. Highly sensitive CRP. CRP is an inflammatory marker, which you want under 1. If your body's inflamed, then the small dense cholesterol is going to get oxidized and harden and plaque up your arteries. The next one, the next marker, homocysteine. You want ideally under 8, certainly under 12. Over 14, you have twice the risk for having a stroke. Homocysteine is a surrogate marker for B12 status. If homocysteine climbs, it shows that your body's getting more inflamed. Hemoglobin A1C, you want under 5.5. The major issue that you want to watch out for is blood sugar mismanagement. Lipoprotein, it's LPA. LPA, you want under 30. LPA is a marker for your clotting risk. So you want to make sure you keep an eye on that. Again, most of these markers, they're almost always left off your traditional standard panel. You want it under 30. ApoA1 between 120 and 160. That is a marker that shows you your ability for your body to clean up the plaquing that's getting put on the arterial walls. ApoB, perhaps the most accurate indicator or harbinger of bad things to come. It is the most accurate predictor of your risk of heart attack. It's a risk marker showing your risk of plaquing and also really just arterial damage in general. ApoB, the most important risk marker for having a heart attack, you want that marker under 90. Again, ApoB almost always left off the marker, the panel, almost always left out of the picture. Then what you now can do, once you have your ApoA and your ApoB, you create a ratio, ApoB, ApoA ratio, and you want that under 0.9. As that goes over 1 and climbs, your risk of having a heart attack radically increases. Insulin, another blood sugar marker, optimally under 5. Vitamin D, 80 to 100, 80 to 100. If you have your vitamin D optimized, certainly over 60 is really, really good. 80 to 100, I consider the optimized range. If you are heavily deficient in vitamin D, certainly under 20, your risk of having a heart attack is radically elevated. In fact, some reports have shown over a 600% greater likelihood you're going to have a heart attack. Or conversely, if you optimize your vitamin D level, you can decrease by up to 600% your odds of having a heart attack. LPPLA2 plaque test. You want that under 200. That is a test to show you your rupture-prone plaque risk. And it shows you how much at risk you are for having stuff breaking off in your arteries and floating around and clotting and creating an embolism or something very serious like that. Uric acid, another inflammatory marker, you want under 5. You should, as a healthcare consumer, demand that these markers are put on your panel, if not yearly, at least every 2 or 3 years. You want to check in on these markers. Comprehensive metabolic panel with CBC, complete blood count. This is your general blood work. You want to make sure that you're looking at least this, and then off of this comprehensive metabolic panel, your CMP, you can at least put together your total cholesterol over HDL ratio, your LDL HDL ratio, and your triglyceride HDL ratio. That triglyceride HDL ratio, the leading marker or number to show you your stroke risk, you want that under 2, optimized. And then last but not least, and very important, omega-3 index. The omega-3 index, omega-3s, of course, are fish oil, DHA, EPA. You want, and this marker shows you, like hemoglobin A1C, which shows you how sticky your red blood cells are. You want that under, the lower that number is, the better. With the omega-3 index, the higher the better. And in fact, the sweet spot is 8 to 12% of the cell membrane of the red blood cells is made of these really good fats, the omega-3 fats. And that's important for functionally healthy cells. So again, you should be demanding to see, thank you, Mr. Reed, I appreciate that. See you on there now. Thank you. You really want to understand, to have a complete picture and a complete understanding, and for you and your doctor, your cardiologist, to steward your health in a great way. You want to have these numbers. Without it, you're really leaving out a huge part of the picture. You're leaving out multiple pieces of the puzzle. And again, what I just went through with you are really the most important markers you not only want to have in regards to heart health, but really total body health. The numbers, the markers, this panel is something that I run on myself every 2 to 3 years to get a good understanding of what's going on. because many times your doctor will not run the majority of these markers and you got to pay out of pocket. And just like my patients, I've got to pay out of pocket for them. So I don't run them every 6 or 12 months. I run them every 2 to 3 years because I got to write a check for it as well. And it's a good size check. A panel like I just rattled off, it can run a good $500, $600, $700 out of pocket. Is it expensive? Yes, but is it important information? Of course. And I'm going to pay for it just like my patients. I've got to pay for it out of pocket as well. And just being a clinician, I don't get like special breaks or stuff. I wish I did, but I don't. I got to pay the same thing that my patients have to pay, basically. So, but nonetheless, very important markers, important in the way of knowing how to steward your health in a great way. Am I on the right course? Do I need to change course? Do I need to change the strategies that I'm working day by day? Am I doing things right? Am I doing them wrong? How do I know? I don't know. I need the markers in front of me to understand. And then eventually, for many people, they're also adding things like carotid artery checks. You're looking at the arteries. You're doing ultrasounds. You're doing Dopplers. You're doing EKGs. You're doing other very valuable cardiac tests. Sometimes there are more advanced tests that you can do to look at the health of your arteries, calcium artery scores, things of that nature. But the blood markers are a great place to start. So hopefully this information is helpful. Again, for my active patients, keep the party on your calendar. Next Thursday, October 9th, 11 to 6. If you are a patient that has a normal standing appointment on Thursday morning before 11, please do not come before 11. We're not going to be open. 11 to 6, only on that day. Food, fun, free adjustments, celebration. It's a party environment. We have a spread of food, a lot of food. We're going to have a fun time celebrating you, our amazing patients. Everybody have a very blessed Wednesday. As always, I appreciate you joining me. We'll be with you next week. Dr. Dan Yachter, the chiropractor, signing off. God bless.